I'd like to briefly introduce iSyncWave EEG recording using the application on the tablet. On the tablet, you can find the iSyncWave application. Click iSyncWave application and you can use your license information. In my case, for example, and the first stage of the app execution, the first stage, the app try to find the GPS signal to find the exact line frequency. The line frequency is differ from country to country. The GPS information can be applied to the notch filter on the real-time EEG monitoring. In the first stage of the app application, the app try to find the GPS, and then you can have this main page. On the main page, you have two functionality. One is EEG measurement, and the other is LED therapy. In this short video, I'd like to introduce EEG measurement process. For the EEG measurement, you can, before the starting the EEG measurement, you can use the setting menu. In the setting, there is a iSyncWave setting, and you can choose the recording time. For example, in this case, as a default, I close 2 minutes, I open 2 minutes, and number of cycles is once set. But you can change this. For example, I close 2 minutes, or I close 4 minutes, for example, like this. And in this case, in my short guide video, I just choose the 2 minute eyes closed recording. And there is another option, for example, noise filter setting. In this case, my country, it has used the line frequency as 60 Hz. The application automatically find the 60 Hz. In some case, GPS cannot find the exact location. You can set manually. For example, you are in the Australia, you can choose the 50 Hz in this menu. And then line filter can be applied for your region. And then we can go to this is the brief explanation of the setting menu, and you can start the EEG measurement. For example, you can enter the new client, for example, like this. You can generate automatic chart number, or you can use your own chart number. In this case, I can use this one. We can use the data. We can fill out the data bus, for example, like this. And we can enter the phone number, and then the handedness. This is the brief registration of new client, and then this is the personal information agreement. I can check the information privacy policy, and then you can go further for the measurement. The first stage of measurement, we have to connect the device through the application, through the Bluetooth communication. We can click the Bluetooth button like this, then automatically connect the device using the Bluetooth. And upper right corner, you can find the battery status. in this case 84%. You can charge the device if the battery is very low. First stage of the image recording is the impedance measurement. Before the impedance measurement, I'd like to recommend the prep two important area for the quality recording. The one area is the center of the forehead used as a ground. You can wipe out using like this, and then you can also wipe out in the wrapped earlobe used as a reference. I also recommend to prep these two areas using the loop prep for the quality recording. For example, like this. And also we can apply the loop prep in the wrapped earlobe. These two areas used as ground and reference. Ground and reference is very important area for the quality signal. So I always recommend the iSyncWave user to prep these two important area using the wet tissue and then loop prep. Then we can easily make the quality signal. And before the first thing we have to do is the wearing a headset. The headset is turned on like this, and turn on the headset is very simple. Just pressing 2 seconds and hold, and it is turned on. In this green signal means the device is connected to the tablet. And then wearing a headset like this, we can adjust the front line. This kind of above. This is the Dyson. This is the standard location. We can align the prefrontal electrode like this, and we can also align the temporal side like this, and then we can gently push all the electrode area like this. For example, in the temporal area, we can gently push these two areas. Then the electrode can penetrate and make a stable contact by gently pushing all the electrode area like this. And we can connect the ear sensor, and this is the PPG sensor to monitor the heart rate variability. Heart rate is monitored at the same time with the 90 channel EEG recording. This is the chin strap. You can use the chin strap like this for not moving the headset during the recording. And this is the brief process of the preparing the measurement. And then click the start on the application, and you can find the impedance color. In this case, one area shows yellow and green usually gives us the quality signal, and red usually gives us a bad signal. In the red signal, we can just push that electrode area gently. For example, in this case, gently pushing the area like this, and we have the one green, one yellow, and another electrode shows green color. And if you don't have any red color, you can go to the signal check. For example, you can click the complete. You can check the signal quality before the recording. In this case, F4 is not good, and we can adjust the F4 electrode before starting the recording. Then we can go back. For example, push this back button, and we can finish the EEG recording, and we can monitor the impedance again. And F4 is not, sometimes the electrode is the conductive polymer. There is the electrode has 12 soft prongs. Sometimes prongs bended very much. In that case, the impedance is not so good. In that case, we can make all the prongs perpendicular to the scalp, and then we can have the green impedance like this, for example, and then we can complete again, and then we can check the signal again, for example, and now we can find the good signal quality like this. Fifteen second EEG signal monitoring, and then 15-second PPG signal monitoring. If you satisfy this EEG and PPG signal, and you can record 2-minute eyes closed recording in this case. And I can click the complete, and then
close your eyes. Measuring starts
start the
in 5
recording
seconds.
like this.
Stay awake while measuring.
And now I close my eyes. You can review the eyes closed signal quality. If I open my eye, the alpha activity is gone. Eye blinking start. Eyes close again. You can find the alpha activity again. And eyes open. Alpha activity disappear. And eye blinking. And horizontal eye movement. There is a noise, teeth grinding like this. Okay, this is the 2-minute eyes closed recording. You have to make the client eyes closed.
Open your eyes. Measuring starts in 5 seconds. Keep your gaze fixed on a certain point in a slightly downward direction in front.
In this case, the default setting is eyes open 2-minute recording and eyes closed 2-minute recording. The patient should maintain the very relaxed position. in some cases, the occipital area has many neck muscle activity. In that case, you can change the sitting position of the client. The default setting is 2-minute eyes closed recording and 2-minute eyes open recording. But you can change the time setting before starting the EEG recording. As I explained in just before. This is the brief EEG recording process guide video, and
Measurement is completed.
after 2-minute recording, after 2-minute eyes closed and 2-minute eyes open recording, the data is uploaded to the cloud, and then you can find the result page. In this case, the result is not activated, but after a few minutes, you can review the EEG signal monitoring, and within 10 minutes, you can find the results. Like this, for example, you can find the EEG summary of specific clients in the source level G-score mapping, and you can also find this kind of underactive area. In this case, the parietal area is underactive, and you can find the two-dimensional charts for the activation profile of the specific brain, and you can find the very detailed ROI explanation and percentile. In this case, the superior frontal activation is very low in this specific case, and you can find also the ROI activation in the temporal lobe. In this case, the average activation of the right parietal area is very low. Among many ROI area, the superior parietal area, the activation is very low. This is the occipital area. This is the brief summary of the 8 brain lobe, left and right. And this is the very comprehensive ROI activation in each brain lobe. You can find also the HRV summary like this. This is the conventional HRV parameter and the percentile value compared to the normative database. In this case, very overloaded HRV simple analysis, two-dimensional chart analysis, and HRV histogram. You can find the 5 stages of stress model. You can also find the depression or anxiety score using the HRV scale. You can also find the MCI probability using this our biomarker analysis. This is the quick explanation of the QEEG, HRV, and MCI summary. And within the 10 minutes, you can find your own data result in this result management page. This is the short instruction guide, and you can take advantage of the this simple iSyncWave EEG recording process. I'd like to add the YouTube playlist in as many as possible. I'd like to add many guide video for easy use of the iSyncWave EEG recording, and also I'd like to explain all the result. I'd like to add the guide video for the result and many kind of quick recording tips in the following videos. Thank you for your attention.